my name is Csaba Szabó. I'm the president of the Hungarian Scientist and Innovator Society in Silicon Valley, which is more like a small group of intellectuals based in San Francisco, or, on the peninsula. And the purpose of our organization is to kind of bring together like-minded people to think about, big ideas and learn from each other, and just find out what people are doing around here. And I'm honored to introduce also Zoltán Egyed, who is our vice president. Zoltán is, you want to say a couple of words about yourself, Zoli?
I'm just the plumber here. I make sure that this video conferencing works, and otherwise I try to help you as much as I can in running our little organization.
Yeah, Zoli is very helpful in running our organization. He does literally everything from scheduling meetings to setting up our website to organizing the calls, making sure that everything is functional. Actually, he offered to moderate the panel discussion today. So unfortunately, I might need to step away from parts of the discussion as I have a board meeting in the same time, but Zoltán will be able to carry on with the discussion. And we do these type of presentations about once a month, and it's usually the first Thursday of the month. So in case you miss one, then you can just email us or just let us know, and we will make sure to send you the invite. It's open to the public. Some of these presentations are being recorded with the permit of the speaker, and then we publish it on our website or on our YouTube channel, so you can stay tuned for that also. The next one is going to be on April the 1st. It's not a joke, it's actually true. And it's going to be Peter Szerémi, who has a master's degree from Stanford University in psychology, and he's going to be talking about the misinformation and why people, become anti-vaccine and anti-this and anti-that, and how misinformation is obscuring our society. So that's, I think, is going to be also very intellectually stimulating discussion. So hope you can tune in for that also. But for now, let's talk about healthcare from the patient's perspective. And it's a great honor for me to introduce Peter Boda, who is our speaker today. So Peter is actually based here in Palo Alto, and he has experience in the healthcare sector and building startups, but also working in large organizations for over 25 years now. His sweet spot is AI and machine learning and experience design, which is a very rare combination. Usually people who are great in building algorithms, they are not as great in design, and particularly looking at things from a user's perspective. But that's not the case with Peter. He has a lot of global experience. He worked at Nokia Research Center in Finland. He is actually, part of him is related to Finland. Last time I spoke to him, he was based in Helsinki for a while, and he went for a working retreat. So he's very much as Finnish, if I may say, as Hungarian in many sense. But he also worked here for Nokia in Palo Alto. He worked for Hollywood Labs. He worked for Infosys and many startups, but also large corporations on various initiatives around things like language technologies, dialogue systems, experience design. He holds a master's in electrical engineering from Budapest University of Technology, and he has a first level of doctorate degree from Helsinki University. But he also conducted studies from California College of Arts in design, and he co-authored about 16 patents and many grant applications. So without further ado, let me give the word to Peter. And Peter, please add anything I have missed from the introduction. Thank you.
Thank you very much, Csaba and Zoltán, and hello everyone. Good to see you all. I even can see one of my friends from Finland. It's pretty late there, but he called in. So welcome everyone, and thank you for your interest towards the topic. Let me start sharing my slides, and with the very first slide, oops, not that one first. We practiced this, but just a second. Here we go. This one. And can you see my title page?
Yes.
Yes, very good. So the only thing I just want to add to the introduction is just want to emphasize my career or my path to digital healthcare, and not spending too much time on this, but really I started my career after my postgraduate studies in Finland, working on advanced user interaction methods, speech and language technology. And what you can see on the top right corner, that's the interaction visualization of the first deployed Nokia corporate dialer with 23,000 names. So nowadays you are just calling Siri, Alexa, or what is the third one, Google Assistant, and you just say something and it's magically happening. We were building those things back in the mid-90s, before 2000, and one of the success was really that one, that our colleagues were using the corporate dialer, and that visualization describes how the system was working. Then with Nokia, with mobile telephony becoming more and more pervasive, we also put some efforts into gaming. That story mashup display, what you can see, that's from New York Times Square, and that was one of the best experiments I had in my Nokia time. It was a wonderful event. Then during those years, we were working on design and user experiments. The thing is, it just before the iPhone 2007, it wasn't called design, so we called it usability, human factors. And I was thinking that something is still missing from my life, so I went back to college and formally I learned that one, what I was already doing. It was just called with different names, and I really got into design, user experiments design, interactive visual. But then about 10 years ago or so, through a personal experiments, and I will talk more about that later, I got into digital health and especially product development, and I realized that all those things I'd done in my previous life, in my previous stages of my career, experiments and service design, UI, UX, and AI machine learning, they're coming very nicely together in this area, and I feels that I'm just this is the best time I can imagine. I can put a ding into the universe with all those things I've done earlier and combining under the umbrella of digital health. And it's really personal, because we are all touched by healthcare. Everyone goes through some experiments that and you can tell to others, or you remember how was it. Something happened in your life, what you remember related to healthcare. It touches everyone. With my family, we had a personal experiment some 10 years ago, and that was really eye-opening. It happened here in the US. It was just mind-blowing after the Finnish healthcare system to realize how things are working or how things are not working. The next thing what happened is that shortly after that, I just realized that looking into the organization and the operation of healthcare and how technologies are used and how everything is built on, I just realized that design, machine learning type of activities were pretty rare in digital healthcare. And basically no one working in design and machine learning in healthcare had previous experiments. They were coming from other industries. So it was really like feeling like this is an opportunity. And around that time, legislation started to take on driving patient rights, digitalization, the Medicare records from paper format to digital formats. It really took on around 2007, 2008, a bit more than 10 years ago. And then what even more exciting is that considering patients as consumers is something I feel very, very important, is more exciting than all the other aspects, because basically you get an equal part in healthcare. So not going to see a doctor and doing everything as suggested, but you have a word and you have a right to say. take part in the decision making. So this timing was very crucial for me to decide that I really want to take part in digital healthcare. And then came data, like how you can utilize the data what you are collecting during a care path or a patient journey, and how that data can drive even better outcomes and better experiments for the patients. So this is the background how I got into healthcare, and I to take this empathetic view to when explaining that what I'm doing and why I'm doing it and how we are doing it is really from the human perspective, and the best way to describe is the patient journey. In somewhere in the literature you might come across the other terminology, care path, but I like patient journey because it resonates to other experiments, especially the journey word. This is a pretty much a simplification: awareness, diagnosis, treatment, and follow-up. And you might imagine that things are not that simple, especially if you think about timing, whether the awareness and the diagnosis are close to each other, whether the diagnosis and treatment follows immediately, and what's happening in the follow-up stage. So things are not that simple as it might seem here. And one further step in simplification is that the ultimate goal of the patient journey is take you from point A to point B, with the hope that in the end of the journey there is a solution to the problem, namely sickness or illness is treated, and the diagnosis is well treated, and we get a patient who is healthy in the end of the patient journey. But again, this is just a simplification. In reality, what's happening is that patient journeys are hardly ever linear, right? So there are ups and downs, there are delays, there are in many cases it can take the duration might be even years or decades, depending on the cases. Additionally to this one, it's not always a point A to point B transition. It might happen so that coming to A, there are some preconditions following or coming out from a previous illness, and in the end, it might be so that the patient is not fully cured, and there is a need for follow-up, or something else happens, and the new patient journey starts from that point. So things are not that simple, and my only message from this this description or this abstraction is that one, that no wonder that healthcare is in a big trouble everywhere globally, and spending is rising with a higher rate than GDP rises in many countries. I don't have the exact numbers, but those numbers, believe me, those are terrible. We are talking about trillions and high percentages of the annual GDP, almost in every country. The globally, if you think about, or many around the globe states that the ultimate goal of healthcare, how we have to fix, is that we have to provide equal access to everyone to the care. We have to provide better outcomes, and we have to reduce the prices. So these three things are, you can imagine, it's not that easy. There are forces working against each other. You need a quite delicate touches to every part of this triangle, and it might be so that you move to the right direction in one way, in one corner, but then in the other one something else happens, and maybe the price goes up. So it's really challenging, but I think that's exciting to work on challenging and hard problems. My view, how things are moving forward, almost in those countries I'm aware of, there are two things going on. One is ongoing legislation, which is great because it provides some framework, some guidance, some regulation. In some places, regulation is very much welcomed. But in some areas, actually, the guidance is the important one, and I'm coming back to that one in a second when talking about the technical implementation. So legislation is very important. I will cite only 2 countries, but from that one you can project to the rest of the world because similar efforts are happening everywhere. And the other thing is that, and this is the consumer aspect. So we have all experiments with online retail, online entertainment, you name it. All those services, applications, solutions we are all using. In our mind, they set very high the bar, what we are expecting from digital applications. So all these other industry solutions provide some inspiration. They are triggering the solutions what we have here. In many cases, someone starting to work on a digital healthcare solution coming from an entirely different industry, taking all those experiments from that industry, but in many cases, like in my case, it happens so that there is an experiment which kicks in the whole change in career, and you want to work on digital health. So legislation. In the US, things are going to the right direction. There are 2 recent legislations I want to point out. One is related to the interoperability, access, and information blocking. And what it means is basically that the you as consumer, you as a patient, you have the right to access your medical history, your data. You can access that one, you can provide to the next doctor, you can ask a second opinion. And basically, this legislation drives further the Obama-era legislation, moving from paper records to electronic health records, and providing also some guidance, what is the technical implementation, and I'm going to come back to that one in a second. The latest thing, the very important, is price transparency rules. So if we are consumers, we want to know what we are signing up, right? And you don't want to be surprised by a bill coming after your care, and not even imagining that this can be the price of the treatment what you receive. So price transparency rule says that healthcare providers, hospitals, specifically in the Medicare domain, but later on it's going to be open for all providers. They have the pricing. So when you walk into a hospital, you have to know how much it costs upfront, and not after that being surprised by a bill with a huge sum. Make sense? I think it makes sense, and it's very important. Of course, providers are complaining because it takes efforts and takes some money to disclose their pricing, and of course, there is a competitive edge that you can hide the prices. So they are not really happy about that one. That's my feeling, and what I'm hearing or what I read about. So this is in the US. I provided here a table. Anyone interested, I'm happy to share my slides, and you can use this as a reference or read further on. What is important from this slide, it's there in the middle with bold-faced fonts. It's called FHIR API. So basically the FHIR API, this is driven by the government and suggested that this is the fast healthcare interoperability resource API. Basically what it suggests that we have to sync in terms of application, how we are connecting one healthcare application to another one, and through this FHIR API we are able to with health data, messages, and the beauty of this system, this new protocol, FHIR protocol, is that you don't have to retrieve the whole Medicare record for one patient. You can just retrieve part of it, like medication or anything related to physiotherapy, anything related to family history. So you can pinpoint what you need. You don't have to get the whole block all the whole record. The message is that patients are becoming consumers. Data and ownership is important. Transparency in pricing is coming. So the idea is that we will have better choices built on the data, relying on the data, medical history, and the pricing data, and we can make better decisions together with our providers. So this is in the US. What's happening in Germany? Before the end of the year, they released the new rule or called Digital Healthcare Act. And basically, this is the first time, in my understanding, the first country ever taking to that level the care that the providers, doctors can subscribe for patients' digital applications. There are two examples. These are the very first two. One is related to tinnitus in the ear and how that application can help relieve the pain or stress related to that one, and the other application is related to handling anxiety disorders. Therapeutic program providing some kind of patient engagement during a given period of time. So what the message from here is that there will be a marketplace for applications, digital solutions, where provider can choose what they prefer and what they are trying to offer as part of the treatment plan for patients. The new digital medication, if you like. Some use that terminology. And with that one, as consumers, we'll have real choices. The interesting things that in Germany, there is a sort of acceleration to this process, and medical apps be easily classified as medical devices. There is a fast track for this classification. So that's the first part. I was thinking that I can stop here for questions anyone has, and then I will talk about other digital solutions I feel that they are important for taking care of the patients along the patient journey.
Sorry, just a little reminder, if somebody's asking a question, please remember to unmute yourself. I can mute you, but I cannot unmute you. Go ahead.
Hi, this is Ivan Erdos speaking. I have a question. You talked about the FHIR interface, and my question, is there any HIPAA compliance built into that interface, or you are responsible as somebody using it to keep it HIPAA compliant?
Yes, so it's part of the HIPAA compliance requirements, and it has a very, very serious authorization mechanism how you can make a request. That's one thing. The other thing, any implementation requires that there is some kind of checkup mechanism before releasing it for the wider public. So a business entity or an entity who deals with health data, they have a set of requirements they have to go through with a digital healthcare startup, how the FHIR interfacing is implemented, and there is a very serious. There are very serious consequences if it's not done in the HIPAA compliant way.
Yeah, and then other question. Thank you. Other question is how broadly it is used according to your knowledge, the FHIR interface.
It's so the earlier version is called HLT7, and that one used for, I guess, more than 10 years. FHIR started to take on something like 3-4 years ago, and I think this take on is more exponential than linear. So I will pinpoint this has the domain, and there are a couple of players, and you will see the names of those companies, so it's easy to check it. Everyone is offering FHIR. Everyone.
Okay, thank you. That's
the future.
Yeah, sure. Thanks.
Okay. Any other question? If not, then let me go further. So I listed here some of these bigger ideas that are related to the support of patient. We have a patient-centric discussion here now. So I listed these topics like AI-assisted diagnosis, explaining in a plain language what's going on, surgery coordination, precision medicine, and so on. But before getting to that topic, I would like to talk some about the new coming data sources. And that's on the left, you can see. And I have few slides. I will run through those. I think they are simple ideas, so I will be very quick. But I think I have one more thing I have to mention. So yes, patient identification, health data interoperability and exchange, and patient engagement. These three topics are more or less valid for the entire patient journey, from the beginning to the end. You need these building blocks. These are the pillars of everything. All the other listed in the top of the, or in the middle of the slide, the AI-assisted diagnosis, explanations, and so on, those are specific to certain part of the patient journey. But these ones, patient identification, data interoperability, and engagement, these are almost like universally needed. So let me just go quickly to the data sources. So you are very aware of what's in the blue box on the left, clinical or medical data. This is what's in your medical record, your demographic information, your family history. When you see your doctor for the annual physical checkup, the nurse takes your vital signs, weight, everything. This is what's in your medical record. But this is a very, very narrow view to a person. That person is viewed as a patient, right? So there are much more what's happening in everyone's life, and there are three new emerging data streams what one should consider. One is so-called social determinants of health. It's known that zip code is highly correlated with your health, with the projected age, the sicknesses, your medical conditions. There was a Stanford study 2018. It was about unexpected death, and it turns out that 75% of unexpected death can be contributed to something else than the medical conditions. It was related to socioeconomic conditions, and this is this part, the social determinants of health, that tries to deal with that one. Patient-reported outcomes got popularity with the emergence of digital health. Basically, think about cancer treatment, physiotherapy, recovery from surgeries, how patients are reporting back to the care team, to the providers, how they are doing mentally, mood-wise, how much physical activity they do, and so on and so on. And then the last one is remote patient monitoring, especially for these patients. It's something very important, and these can be connected to your medical records on your provider side, but which is more consumer type of application area is the wearables. So I have one picture of that one just to make the point clear. So this is the clinical data. Here, the most important part nowadays becoming not that one that you have a snapshot of your medical conditions, but you can go back in time and look at the patient's medical history. This was one of my focus at my former company, Health Gorilla. We developed the solution called Patient 360, which was one of the first interoperability solution. With one single click, the provider. So I step back. You go to see your doctor, and your doctor is asking you that, how are you doing? And how was 2 years ago? How was 3 years ago? And the answer is that I don't remember. So at that point, your provider, your doctor, physician, can click on one single button and retrieve all your medical records from the country, from other providers, and putting things together. This is an extreme visualization, so this was just a mock-up, a prototype, but something like this you can imagine that you can pull together the medical. It's more textual what's in reality, not this visual. This is the social determinants of health, and these are simple things. Do you have enough money to see your doctor? Do you have how is the housing situation? Do you have problems getting childcare, getting your children to school, and so on? This is an emerging area, and this is very important to follow and to provide means for patients to report back on their socioeconomic status. Patient-reported outcomes. Again, simple question is, on a daily basis, something is popping on your device and asking about, in a very simple, intuitive way, answering yes/no questions, or rating your pain level, rating your mood or other activities on a daily basis. And what you can see, what the provider can see on their side is some kind of summarization about the patient's condition, providing means to intervene if there is an issue, emerging issue, based on these reports. And the last one is the variables. So here I'm showing readings. This is my data, my jogging and my sleep pattern, everything. Surprisingly, a lot of data can be collected through these devices, and now the newest functionality that you can provide, you can create a report and you can share with your doctor. Of course, the real issue is that how you are using this data, how you can find correlation between the different data streams, and whether you are able to come up with an idea of what's really going on in your patient's life. But that now with all these data streams, you are looking at your patient more like a whole person, which makes a huge difference. So this takes me to the data sharing and the data interoperability and the exchange domain, which is, here are these companies what I was just answering the previous question about FHIR. So FHIR is really the key. With that one, we can access not only from medical records, but also other coming data sources. We can pinpoint certain elements and just access that one what we need. So Redox is one of the big players here. Particle Health came a couple years ago. They focusing partly on how to support the insurance domain. So an interesting use case that how to use health data to provide a better insurance coverage and taking into account formulating new insurance plans. Intercept is a long-time player, not only in healthcare, but in general in data technology. And HealthGorilla is my former company when I was working on the first interoperability solution. So this is in the US, just these few examples, and there are much more, and everyone is working on FHIR. The interesting thing here is this one. So there are two entities, Care Quality and Commonwealth. They are more or less like, I wouldn't say non-profit, they are more like some kind of alliances. On a national level, they are basically the ones who built out the networks to the providers. So if you join Care Quality or you join Commonwealth, you are able, through them, via a single interface, you are able to access Stanford, Kaiser, you name it, East Coast, West Coast, and the rest of the country. A while ago, Care Quality and Commonwealth, they figured out that they are pretty much doing the same thing. So guess what happened? They made a bridge between their two systems, and basically nowadays it doesn't matter which one you sign up, you get access to the other network as well. And we are talking about tens of thousands of providers connected through Commonwealth and Care Quality. And if you use any of these companies providing the FHIR access to health data, you are able to access meaningfully the medical records and the medical history of your patients. You can also build out yourself using FHIR. It's not that difficult, and there are open source solutions for that one. But my feeling is that paying a bit for a turnkey solution makes sense, and you can save a lot in terms of efforts. I'm speeding up a bit. This is my current company, Medi4. So accessing medical data and retrieving it and exchanging medical data is one thing. Somehow, over the years, it turned very, very difficult to do the very same thing for medical images. And sharing medical images is not solved at all. It's really a problem. It's really an issue. So my latest experiments, after I had an MRI, I was asking the reports from the doctor. I could access it electronically, no issue. I could download it, perfect. But when I was asking for the images, I had to walk to the lab, and then I got on a CD-ROM. And to my surprise, it said that readable only with PC Windows. So I couldn't really use it. So sharing medical images is really an issue. And what we are working on, this is our very first use case beside focusing on process optimization. The medical image sharing, you can imagine. So you want to get a second opinion from another provider on the other side of the country. Or medical tourism, you want to have a surgery on another part of the country or in the country. Online consultation and coordinating the care after surgery or before surgery, sharing images. It's not trivial, and it's really a hard task. Few companies are working on this. Patient identification is also another pillar of the whole ecosystem, and I compiled a summary a while ago, and the conclusion was that there are few countries where unique health identifier is available, but there are other countries they chose some other secure and efficient methods like Sweden, Finland, those bank identification-based solutions. And then there are mixed solutions like here in the US. So you might think the social security number can be used for patient identification, but it cannot, because it's a government program, government project, and healthcare is private. So social security number cannot be used for patient identification. Every single hospital provides a patient ID to you, and those patient IDs are different in different hospitals. And just guess how difficult it is to connect the dots when you want to retrieve your medical history. So this is really a challenge. There are a couple of nice solutions, like national level solution. One of them is in Finland, and I copied the English version, and you can check out there are the web pages. So the Omakanta, which means in English something like own medical records. The beautiful thing is once you log in there, you can see all your medical history except medical images, and also for your children, which is really great. The identification system in Finland is not specifically targeted for healthcare, it's targeted for everything. So when I logged into my former university website to handle some bureaucratic issues, I had to identify myself. I was using exactly the same system as here on the right side. It's a bank-based identification solution in 2 steps. Because the idea is the following. So once you become a customer of a bank, it means that you have to go to the branch, to the office. This is before COVID, right? When we were going to see, we were going to visit places. So the idea at that point, when you signed up as a customer of a bank, you were identified, and all paperwork were checked. So then you got the identification mechanism, which is either a digital application, a small electronic device, or some other solution. And using this one, these are the different banks in Finland. You are able to log into your own system, and this is a national system on the left. So the own medical records, doesn't matter which hospital you go in Finland, all the data is there. This is beautiful. Something similar is working in Hungary, in my understanding. I never tried out, but my parents telling me that this is there, and it has a unique health identifier solution. I think is the TAE number. I don't know what it means actually. But all your medical history related data, medication should be under this platform, and with a simple identification you get into it. You remember my slide here when I was talking about the patient journey and these other solutions. So just very quickly, I want to mention some of these solutions without providing an exhaustive list here. So on the top left, AI-assisted diagnosis solutions, Babylon, Etsimo, K-Health, they are all simple chats, and during that discussion with the system, the patient can provide information about his or her condition, and the system is trying to figure out what's going on. Etsimo is a Finnish company. They are providing a solution for one of the clinic I had to interact with before coming back this week, and I had to do the COVID test, so it was asking all kind of questions, and then it also scheduled my COVID test. On the right side in this part of the slide, Bina AI, an Israeli company, Google, and CUBX, a Spanish-Israeli company. These are interesting efforts. They are also doing some kind of diagnosis. They are taking the vital signs in a contactless manner. This is an emerging field, and especially now in the COVID era, it makes a lot of sense that without touching the patient, just from the video signal, they are able to measure the temperature, the oxygen saturation, the pulse, the breathing rate, and it's still not solved, but it's coming. The blood pressure. It's difficult, but it's coming. So Bina AI is a well-known. They got a lot of publicity. They won some competitions, and it's interesting to how they are providing a solution. In the bottom, I just copied a snapshot from a upstream work from how to use the vital signs and what kind of decision can be made having the vital signs plus medical history plus socio-economical data. So what you can see, this is a visualization of a machine learning module. The green area of the map indicates that what is the percentage or what is the likelihood that the patient in the emergency room, after the vital signs are measured, is going to be admitted to intensive care, and the rest is discharged, going home. This is it's a bit personal project. My eldest son did it last summer as a summer project. He's a high schooler for a Swedish company, and it was just mind-blowing that what you can do with a lot of data if it's available, anonymize the medical histories and vital signs. And it was fun, this project. In the middle, there are a couple of things. Medicus AI is a Near East Vienna company, and they are providing explanations in a plain language to your test results, to your medical conditions. Very interesting, very intuitive, very nice visualization. How test results are explained. Just imagine the elder population who doesn't really speak the language of the digital era, or younger generation who don't really understand yet the medical terms. It's not that easy to get an idea of what's going on if you are taking a look at lab results. So they provide a very nice solution for that one. Precision medicine is another interesting and emerging area along the patient journey. Here I'm mentioning two companies. Cyapsa is a San Francisco-based pioneer of precision medicine technology, and Encompass is an emerging new company from Budapest. They just won a competition on an EU level as a future unicorn company. They are both doing the following things, that they are taking genetic information, and based on that one, they are trying to figure out what is the best matching treatment solution what a cancer patient should receive. They can save a lot of time, a lot of efforts, a lot of trials, a lot of pain, and they are targeting the solution to that specific problem what the patient is facing. Body Healthcare is a Finnish company. Memora Health is based here in Silicon Valley. They are both providing some level of patient engagement and communication means with the care team, especially before and after surgeries. And I mentioned earlier the patient-reported outcomes as patient reports, patient-generated data. These two companies, Nona and Kaiku, they are from Helsinki. Nona was acquired in 18 October by Varian here in Palo Alto. Both companies offer solutions for cancer patients after therapy or during the therapy, how they are reporting back to the care team about their conditions. And I just put with a very small logo my first effort, Lumila, that was a parental engagement solution. That's the product we built about 10 years ago. About 8 years ago, after I had the personal experience of having a premature baby. It was exciting to work on this topic. Eye-opening. I think I'm done. This is my very last slide. So we are going to that direction, that all these patient journeys, those are represented here with these fuzzy circles, how we are delivering the care, how we make decisions, and how the generated data is used. They are sort of feeding each other, and this leads to some kind of learning health system. My investor friend Scott likes to call it computational care. I think they are the same. The idea is really that one, that the more interaction and engagement we have patients, the more data is available, and that data can be used to feed a system that is learning and able to provide support for decision, not necessarily the decisions, but support to make the decisions and making the patient journey a smooth experiments or smoother experiments. So I think I'm done. I just want to point out that favorite source for news and following what's going on is, beside LinkedIn, of course, CB Insights. There is a free and a premium version. Newsletters, quarterly summaries, investment trends, beautiful visualizations. So this is one from, I guess it's from last year, just the AI domain in digital health. It's a very good source. And two more slides. I have a portfolio website where I'm listing some of the projects I did in the past years or so. Most of them are related to digital health, but some of them are related to just design, visualization, or user interaction. And if anyone wants to follow up, I'm more than happy to provide my slides or provide answers. Please feel free to reach out. Thank you.
I have a question. I mean, you have gave us a very comprehensive and detailed description of what is happening, and we saw a very interesting set of initiatives. What's your estimate, like 5 years from now, 2026? Are we going to see just an incremental change from what we have now, or is it going to be a fundamentally different user journey? What's your own opinion? How far is it going to get?
So I think the industry went through during this COVID, and we are right. So during this COVID era, it was like an explosion of digital solution, right? But I'm not entirely sure that the adoption on the patient or the consumer side happened in the same pace as on the industry side. So there are many initiatives, there are many new solutions or applications pushed out, but but I'm not entirely sure about the utilization or the acceptance of those solutions. So I think there is 5 years from now, there is a question mark about preference by patients, by consumers, what's accepted, what not. My guess is that it will evolve in a way that it needs to take care of patients' opinion, patients' feedback. There will be some positive feedback by the patients, how to modify things, how to make it better, how to make it easier, more accessible. I'm not entirely happy, for instance, how I tried out myself. I mean, not for the sake of trying out, but because I had to call in for a video visit. It's not the smoothest experiments yet. And I'm very sure that others, I'm a technically savvy guy, right? So I'm not sure everyone has the same experiments.
Thank you.
Not sure I answered exactly what you asked, but I think there is going to be an evolution. That's my guess. Anyone else? Was it really far-reaching, or it didn't touch?
No, I think it was easy to understand, and it was very interesting at the same time. I really appreciate the breadth of information about the market and the participants and what's going on, what are the trends. Probably that was your goal with the presentation, to explain where are we going to or towards.
Yeah, yes.
And, yeah.
And I really wanted to take the patient-centric view, I mean, from our perspective and not from those who are driving the technology, because the technology, they can imagine whatever, right? And put it out there. But
right. And actually, I think this is a very, very valid point, because we IT people are really ready to develop a new app, a new system, a new architecture, and we don't really care the experience, what the users are going through. And in this case, especially because it is related to a lot of sick people who are in a trouble when they are using the system, it is really important to provide a very, very good GUI and everything. So yeah, that's a very interesting point of all of that. And I see a lot of issues yet, but it is going to the right direction. And actually, that very sad pandemic situation helped a lot to move into those online and IT-based solutions in healthcare too. So that's an opportunity, I think.
Thank you. Let me just show something here quickly on the camera, and then I think Esther wants to ask something. So this is my ideal digital application. It looks something like this. Oops, I have to switch off the blurring, right? Otherwise you can't see it. Change background. Sorry about this.
Or if you keep it in front of your body, it usually keeps it at that point.
So this is my view of an application. I mean, patients are in a trouble, right? Patients don't want to think about menus. There are few things you want to do. It has to be big. It has to be easily accessible. You don't want to think what you want to do. There are 3 things this application offers. We are offering that on the front page. That's it.
Yeah, that's a very good point, and it should be based on common solutions, like anything what you are using every day, like Facebook or Apple Pay or whatever. And very often the providers are coming out with some really great, really nice solution, which is not similar to anything, and you have to learn how to use it.
Right.
Yeah.
Esther, please.
Just a quick question. You have been talking about clinical applications. I'm interested if you have seen any prevention-related application or behavior change-related application.
Yes, so one of the best example is really like Biddings. It has in the application, you get suggestions, how much you are moving, how much you are sleeping, all those feedbacks coming back, and those are very enjoyable 2 minutes readings, and give an idea what you want to change or you might want to change. Behavior change related solutions are very tightly coupled with mental health. That's one area I haven't touched here, and there are few interesting companies. I'm happy to provide those in a follow-up email. But yes, so in many cases, you can see that the company is providing some way of interaction with a patient, whether it's an AI-assisted diagnosis or patient engagement solution. In the second page of their functionality list, they are mentioning that they also want to provide some feedback how to change behavior. And in many cases, it just doesn't work yet. In many cases, it's very simplistic. But I think I have couple in mind where they have a positive effect. So happy to follow up on that one.
Thank you.
I also have a question. Hi, thank you very much for your presentation. It was very interesting. And I work in the mental health care, so I'd be really interested in diving deeper into your experience and expertise in the mental health. But actually, my question would be more around the elderly population, because they're a humongous population in the healthcare. But they have difficulty using, at least the elderly now. Maybe in 20 years, the elderly will be more, technically savvy. But right now, it's very difficult for them to use technology, being that just even a plain video conference. So, do you see any companies that are looking at the elderly and trying to figure out how to best create products that enable like more quality healthcare through digital?
I don't have any single one right now from the top of my head, but every single company who tries to provide some kind of engagement solution for us taking care of our parents, they are providing also a simple interface for the parents, just to check in, just to provide feedback on is the medication taken today or not, and simple. So actually, my former colleague from Nokia, he set up the Aging 2.0 initiative, and you might want to check out that one. It's called Aging 2.0. That's the name. And it's so successful that now they have a VC company based on that one. And they used to have events here at Stanford and competition on that one. And it's really a growing domain. I followed them for a while, especially from the patient engagement point of view. And I figured out that really the best design solutions are what they are providing is just as simple as you can imagine. So I got the inspiration. I did this one, what I was just showing you, the 3 choice. You don't need more. I mean, you are getting lost.
Thank you.
We have a couple of people who raised hands, Sam and LK. And also Eva Boysen.
Sam, go ahead, please. We can't hear you.
There we are. Yeah, really enjoyed the presentation. Really nicely put together. I guess something that I see. I work in the commercial side myself, and we work with say pharma who are endorsing the kind of digital therapeutics, especially as you say in the area of mental health. And I think it's quite interesting because what we see is obviously on that regulated side, in terms of those digital therapeutics, they're being brought forwards and given to patients to help them support and deliver their value. However, in another space, which is kind of more unregulated, we see wellness apps, which almost serve a quite a similar purpose in terms of maybe towards what Esther was saying in terms of that kind of behavioral incentives. So my question is, do you see that there might be a convergence between these kind of regulated applications and maybe the unregulated one, as we see wellness becoming something that is advocated more in the regulated space? And perhaps this comes back to what you were talking about in terms of the evolution of the kind of regulatory framework, in addition to the innovations that are then being able to be driven from within it.
I think there will be a moment in time when providers, both providers and patients, consumers will rely more and more on wellness type of data. And you remember one of my slides when I tried to show that these 4 different data sources coming together to provide a whole picture. So if it gets more emphasis, that domain, the wellness domain, it will become an essential part of describing your medical condition. It will be only one aspect of it, but it will be important. And at that point, it will have an effect on the regulatory efforts. I mean, already now, Widings have a real issue getting the newest device here in the US, because that one is already measuring the AKG, right? It already got accepted in Europe. You can buy it anywhere, but not here in the US. So there is some kind of exercise, if you like, right? Get it right, because providing heart failure related data is not. It must be very reliable, right? And it's still in the wellness domain. It's not a medical device. It's just a watch. Did I answer the question? Or
yeah, no. Yeah, for sure. It's I guess there is no right answer, is there? It's a hypothetical question. So it's just it's great to get your perspective. So
I think the whole wellness era is a domain for regulators that they just can't imagine how it evolves. So they are more like in a catch-up, follow-up mode, right?
Yeah.
Versus pharma and the other domains are more traditional, if you like.
Yeah.
Eva, you had a question, or?
Oh, yes. Thank you very much. I think we may have met sometime in the past.
Yes.
Yes. Indeed. And at one point, I was attorney to Nokia before they were into healthcare. And that's how far we go back. So I'm a consumer as well. I just want to make the comment that we knew we are heading toward the consumer-driven healthcare, because all of a sudden, maybe 5 years ago, TV started showing ads, between Stanford and Kaiser. So the medical providers were gearing to the consumers, and the pharmaceutical companies, etc. So we know we're heading there. I'm in my practice, I sometimes deal with medical issues for clients for whom I may be elderly clients for whom I'm trustee possibly, and I interact with families who all over the world. And it's like you comment that it's a very necessary service to give the families taking care of elderly parents, especially remotely. Of course, you don't have to be that far, but many times the option of healthcare or the choice of healthcare comes up. The patient is given the choice, and then the families in some parts of the world are absolutely outraged that they have a choice, because you come from a culture, maybe a different culture, where whatever the medical profession says, you do. And in the United States, you obviously, the doctor explains your options and then you choose. And so there I see, it's more of a comment about different philosophies too.
No, you are very right. So what with the new pricing transparency ruling, my guess is, or my forecast is, that it takes maybe a couple of years that we will see a new type of market, right? Because how we grew up is that we went to see the doctor which is closest, right? That's in our region. That's how we belong to. But once having a marketplace, you have a choice. There will be a competition in pricing, in quality, and add to the top of that one that what came up with the COVID era, that you don't even have to go and see a doctor. You can see it here over the video call, right? So, so the very first decision when March or April, how you can provide televisit. So before that, you could provide televisit within the state, right? That was the regulation. But as the demand rised and you cannot go and see your physician in person in the office, they stopped this, or they raised the bar, and basically you can have a televisit consultation with someone sitting on the East Coast. Nothing will prevent us to have the televisit consultation with someone sitting on the other side of the world. It's not that far. And at that point, when you really have these choices, there is going to be a marketplace which will drive the prices, which will also affect the quality considerations. And I think it's for the best of all of us.
Thank you.
Eke has been trying to ask a question for a long time.
Oh, yeah, go ahead, please. There is a hand I can see, yes. I can't hear. No.
We cannot hear you yet. You are probably muted on your side somewhere.
There, is that better?
Yes, now it's good.
Thank you very much. My question has to do with the, originally we talked about HIPAA regulations, which in the United States, I came upon, had an experience, personal experience with working for a company who provided health insurance for their employees. And then the health insurance company wanted to give the employees $250 if they would turn over their vital information, their annual, the information that they got from their annual physical with their doctor.
Right.
Now, in doing that, if they took the $250, which was simply applied to their deductible, they were not given $250 in cash. What they did was they overrode the HIPAA law. And as I researched it, what I discovered was that the federal government of the United States of America wanted, that was behind this because they wanted to get more information and data on the health of the American people in general. And ultimately, the idea behind it was that if a person was not taking care of their health and not following their doctor's orders, that individual was then going to be charged more, had to pay more for their health insurance than an individual who was taking care of their health. So I'm wondering how that would work into what we're talking about here today.
So I think this is a very dangerous area, dealing with someone's health data. Just one anecdote from Finland. It was there was some initiative from insurance companies that having wellness data considered in formulating the insurance premium, whether it makes sense or not, and basically they shut it down, that initiative. They said that no, you cannot ask that one, although they are asking that one whether you are smoking or not and what's your age. But those are historically accepted data points. So I think it's disclosing health information for the purpose of being treated differently, or having a different price point, or getting a different service, or a punishment. I think it's not the right. I think it's more interesting to motivate the patients to follow the orders, and then it comes with patient engagement. And then if you report, or patient reported outcome, if you are reporting, you can win an Amazon card and not the $50 deductible reduction. First of all, I think the $50 is very cheap.
Yes.
Cheaply sold for that data. But some other incentive which actually there were. I remember the end of my Nokia career, there were some initiatives like making it more like a playful gamification type of interaction, earning points if you do this, that, if you exercise. but it didn't touch the health data. It was more like trying to motivate you in a different way. And I think people are more responsive to that kind of initiative.
I agree. Thank you.
So if we don't have more questions, I would like to thank Peter again for this very good and very detailed talk. Thank you very much. And I don't know if you would like to make your slides available for the participants, or what your thought is on that.
Yeah, I put on my Dropbox, and I will send. Then you feel free to share it, please.
Then we can send out the link to the slides to the participants.
Yes.
With BCC, so you will not see each other's email. We try to be careful.
Yeah. And please feel free to contact if you have further follow-up questions. Happy to.
So with that, thank you very much again for Peter, and thank you for all attending and asking the questions. And please remember that we have these kind of talks usually once a month, and please stay tuned, and you will be very welcome to our next talk in April 1st. Thank you very much.
Thank you. Bye-bye.